Let's talk about microplastics in human livers. A little different intro for this video. Normally I start with a popular article and then move to the scientific article. In this case, a quick Google search did not yield any popular articles that reference this, but it is quoted fairly regularly by other scientists, often quoting this as evidence for microplastics in human liver, which is a gross injustice because there's really a lot more to this paper. I think the people who quote it that way maybe just look at the title, they see microplastics, they see liver, and that's maybe all they read. But let's look at what it actually says in this paper. Considering the limit of detection, all liver, kidney, and spleen samples from patients without underlying liver disease tested negative for microplastics. That means all the healthy tissues, livers, kidneys, and spleens, did not have any measurable amount of microplastics in them. However, in contrast, microplastic concentrations in cirrhotic liver tissues tested positive. So cirrhotic tissues are just damaged liver tissues. These came from people who were undergoing liver transplants. So the livers that were removed, the cirrhotic livers, did test positive for microplastics. So that's the report. Let's look at their data and see if it holds up. This is figure 2 from the paper that I just showed you. It's a nice summary of all of the data that they collected from the healthy and the damaged tissues. What really jumps out at you immediately are the red triangles that are well above the LOD, the limit of detection, and in 3 cases even above the LOQ, the limit of quantification. In contrast, all of the blanks and all of the samples from the healthy tissues are below the limit of detection. And of course, the LOD is calculated from these blank samples, so you would expect that. So this seems to support their data. So what is the issue with these data? Seriously, what is the issue with these data? I could not find any issue. It all looks good to me. They have a sufficient number of blanks to do these calculations. Their positives are well above limit of detection and often limit of quantification. But what really drives this home for me is the fact that these healthy tissues are in the noise. So why is that important? Well, the perfect control sample for a tissue with microplastics isn't really just nothing, which is what the blanks are normally. It's a tissue that is similar that doesn't have any microplastics in it. And of course, that you can't know a priori what tissues don't have microplastics in them. So it's hard to design a set of experiments that gives you this kind of data. But it just works out that all of these healthy tissues did not have microplastics in them. And so that gives you a lot of confidence that throughout all of the tissue isolation, the tissue storage, tissue transfer, the weighing steps, all of that stuff that happened to these where they found microplastics also happened to all of these where they didn't find microplastics. So I find these data to be very trustworthy. And as a scientist, this is a breath of fresh air because, I've been reading scientific articles for about 35 years, and in every other field I've ever looked, this is sort of the norm. I guess in this field, it's more of an exception. But it's really nice to actually have some data that we can trust, and now we can do what's more fun as a scientist, which is to analyze it and see what it means. On the other hand, as a human being, this is kind of bad, right? I don't want to find microplastics anywhere in our body. This is bad news. It's sometimes treated like, a triumph by some people, which is sort of odd to me. It's a little bit perverted logic that gets you to consider this as like, good news, right? A lot of times, a study like this will be like, oh, this is good news. We found microplastics. No, this is bad news. But anyway, let's look at their data a little bit more and see what they have. So I want to go through their method first. And so what they do is they digest the tissue and then filter what they have left to isolate the particles. they stain with Nile red, and that is a good way to distinguish organic particles from inorganic particles. So you don't stain things like sand or ceramics. Any inorganic particle that may have gotten through this process will not be stained here. So if it stains with the red, then you know it's at least an organic microparticle, probably a microplastic, although it could be something else. And then they analyze using these spectroscopic methods. But the important thing is here, they did some method development here, and if you read their supplemental material, they go through the details of what they did. They started with a potassium hydroxide and sodium hypochlorite digestion, so that's caustic and bleach. Those are just the chemical designations for caustic and bleach. They did this digestion and they found some microplastics, okay? And I think they did 3 samples there. But rather than just taking that and running to the Guardian and warning the world about, liver disease caused by microplastics, they looked at their data and they decided that it wasn't good enough. So they weren't getting a good enough distinction between their analyte and their blanks. And they didn't feel good about the reproducibility, and they also felt like they could make some improvements in the ease of the filtration. And so what they did is they added another digestion step with hydrogen peroxide, and they also added some acetone during the filtration for what they call defatting, but basically it means to help the soluble organic components go through the filter, and it eases the isolation of the microparticles. I just wanted to point this out because a lot of the articles that I read in this area, they don't really do method development. They pick a method, and as soon as they find microplastics, they feel like they're successful. And what you really should do is make sure that your method is giving you good, reproducible quality data. And they did that in this case, and maybe that's one of the reasons why they have good information. Okay, so I just wanted to quickly point out, this is a summary of the types of microplastics that were found in the kidneys. People sometimes talk about plastic like it's all one thing. There are really a lot of different kinds of plastic, and even within these plastics, there's different grades within each type of plastic. But broad strokes, they find polyethylene terephthalate, that's polyester. Could come from a water bottle. It could come from a fabric. Polystyrene, so there could be styrofoam. It could be polystyrene packaging, something like that. PVC. PVC is a very interesting one because you don't see a lot of PVC particles in the air or in the water, and it's not commonly used in clothing or packaging. It is a little bit in packaging, but not commonly used as some of these other things. So that one's a little bit of a mystery, and I'm going to come back to that. The blanks, they only looked at 5 of the particles from the blanks, but they see polyester, polystyrene, silicone, and then one they couldn't identify. So like many good scientific articles, there are more important questions that come out of this work than answers. And the most important one is one that the authors ask within the paper. Are microplastics causing the liver damage, or are they a consequence of the liver damage? In other words, does something else cause the cirrhosis? And once the liver is damaged, it no longer is able to clear the microplastics like it could when it was healthy. And they don't really come to a conclusion here. To my reasoning, because they found microplastics in all of the damaged livers, it's hard for me to understand how it could be a cause. That would indicate or imply that microplastics are the only cause of liver damage, right? Or at least it has to be a cause and a consequence. That's the only thing that makes sense to me. So maybe it's a contributing cause along with some other factors. And by the way, regardless of what you think about microplastics, if you're really concerned about liver health, there's another chemical that's much more important, and that's alcohol, right? So, it's not like microplastics are the number one concern when it comes to liver health. But nonetheless, this is a very important question and one that needs to be answered. Another one that they struggled with is the precise location of the microparticles within the damaged livers. They use some terms that I'm not all that familiar with, but basically, there are different subsections to the liver, and they really kind of got derailed here. They started thinking about, well, there's microplastics in our blood. What does that mean? Because it's not in the spleen and the kidney. And so, you kind of see in their discussion here how good science can get derailed by bad information, right? So they're assuming that there are microplastics, a lot of microplastics in the blood at all times. And we know that's not the case. And I think if you read their discussion, you start to see why it's so important for scientists to get it right, so that we can have good models and good information to work from. Another question, and this is not one that was in the article, but one that I have that I think is important, is where's this PVC coming from? It's not in any high prevalence in the air or food or water in any of the studies that I've seen, and yet it's a very prevalent component in these damaged livers. And I'm concerned that it might be coming from IV, like any intravenous treatment you get. That bag that's attached to the tube, that's attached to the needle that goes right into your vein, is made out of PVC. So the bag is made out of polyvinyl chloride. And, microplastics that we're exposed to through inhalation or ingestion, so breathing or eating, they get into our bodies at a relatively low rate, but if something is in that bag and it goes right into your bloodstream, that's 100%. So that's something that if I were working in this area, that is a question that I would try to answer sooner rather than later. Okay, so that's microplastics in the liver. I thank and congratulate the authors for a good paper and for contributing to a scientific basis for considering issues of microplastics and their effects on human health. And I thank you for listening, and there's more to come.